Good morning everyone. Psychopharmacological agents are the medication that affects the mind and behavior by altering the brain chemistry. They are used to treat various mental health conditions including anxiety, depression, psychosis and bipolar disorder. Psyche means mind, which is affected by various stimuli which induce behavioral changes in individual, which termed as a psychosis. The agent which induce psychosis are known as psychotics, for example, morphine and nicotine. Psychosis has two types. First is schizophrenia, which is also known as major psychosis, and second one is mania, which is known as minor psychosis. The psychosis affected due to the cerebral deformity is known as major psychosis, which is known as schizophrenia. Schizophrenia is a group of mental disorder which is characterized by disorganization of patient personality. And the psychosis which is affected due to anxiety, depression is termed as minor psychosis, which is known as mania. Antipsychotics Antipsychotics are the pharmacological agents which are used to treat the psychotics. Classification includes first antipsychotics, which is known as neuroleptics, which is also known as tranquilizer, for example chlorpromazine and chlorperazine. Then second is anti-anxiety and anxiolytics or minor tranquilizer, for example diazepam and oxazepam. Third one is antidepressant, which are also known as mood elevator, which consist first one is tricyclic antidepressant, example imipramine. Second one is monoamino oxidase inhibitor, example nalcipramine, and fourth is caffeine. Now, antipsychotics, neuroleptics or tranquilizers. Antipsychotics are used to treat psychosis and other behavioral disorders. Tranquilizer reduces psychotic symptoms and patient feels comfortable, but it do not cure the basic disease. Tranquilizer means to calm. Then pharmacological action of chlorpromazine. Chlorpromazine is also called as the largactil because it consists of phenothiazine nucleus which has antipsychotic, antihistaminic and anticholinergic activity. It is used in major psychosis. It is used in local anesthetic. It has skeletal muscle relaxant property. It is used as an antiemetic which depresses the CTZ centers, which means chemoreceptor trigger zone, and promote the lactation. Hence, chlorpromazine is also known as the largactil. Anti-anxiety or anxiolytic drugs. These drugs are used to relieve the anxiety and tension. For example, diazepam. Now, antidepressant. Antidepressant are the drugs which are used to treat the depression. For example, imipramine and desipramine. In monoamino oxidase inhibitor, when the patient is on monoamino oxidase inhibitor therapy, they should not eat cheese butter banana because the cheese butter banana combines with the tyramine. Tyramine metabolized in the presence of monoamino oxidase enzyme. So, when the patient is on monoamino oxidase inhibitor therapy, it inhibits the monoamino oxidase enzyme. Tyramine is not metabolized and converted into the adrenaline. And adrenaline increases the blood pressure and produces hypertension. It may be harmful and produces cardiac problem. Hence, cheese butter banana should not eat during the monoamino oxidase inhibitor therapy.